Hey, Dr. Henry here. Hey, so I got a question recently about health insurance. And what they were asking is, hey, I pay so much for this and I feel like I get zero benefit out of it. And so I thought about some pointers on how to best utilize your health insurance. And so first thing I thought of was that this time of year, so it's October now, a lot of us have met our deductibles. So if you have any medical expenses or things that you've been meaning to get to, now is the time. When you've met your deductible, start in October. All of our offices get swamped by like November, December with people trying to do that. Start early. If you know you are about to or have already hit your deductible, now is the time to get the care that you've been putting off or said, hey, I'll start that soon. Don't wait till January and your deductible starts over. So that's number one, is take advantage when you've already met your deductibles. Another is check and see if you've utilized your benefits. So like in chiropractic, you have a certain number of visits per year generally. It starts over in January. So if you know that you need to get care, doing it at the end of the year is generally a great time to make sure you've utilized the benefits you already have. And then if you end up needing more benefits than your insurance covers, the year will be turning over soon and you'll have that available. So make sure that you've utilized your benefits that you have available if you feel like you need it. I'm trying to think. The last one would be, let's see, we talked about, if you have an FSA, flexible spending account that your company contributes to, those things expire every year. So I always get that scramble around December of people saying, hey, I've got these FSA dollars that I need to use. Can I get in? Start thinking about that now. Start planning out your expenses. It covers things like, it covers anything that you can normally use like an HSA, a health savings account on. So sometimes that's going to be like contacts, glasses, chiropractic care. These are all things that are included, but those dollars expire at the end of the year generally. You want to utilize them. HSAs roll over, there's less urgency, but that's really important. So make sure that if you've met your deductible, if you're close, you utilize the care now while you still have time. If you have visits or benefits left, make sure that you take the opportunity to utilize those before the turn of the year when that total starts over. So that will allow you to have more access to care. And then if you have funding through a company like an FSA, be sure that you're utilizing that now before it expires at the end of the year. Okay, those are my tips on maximizing your insurance benefits. Let me know if you have any more questions on that.